widespread epidemic. We continue to pursue economic growth while averting a catastrophe in the health of our people, and that is the underlying principle. And therefore, in pushing the multi-sectoral agenda, various stakeholders are working with the ministry to ensure that we have a mechanism that prevents new infections while we allow movement of essential goods and trade to flow smoothly. We did have our second meeting as African Union yesterday, where we reaffirmed our commitment to regional and continental trade, where we reaffirmed our commitment to the continental strategy to stop COVID-19. We have identified as a continent the need to ensure that we avoid transmitting or accepting new cases in our various jurisdictions by strengthening surveillance. We've also accepted that we will strengthen community surveillance, increasing testing in our communities to ensure that we avoid receiving cases in our facilities that are already ill, but pick them up early enough so that we are able to support them in our facilities. Furthermore, I also want to emphasize the need that was looked at AU for us to ensure that procurement is pooled so that movement of testing kits and other PPEs is eased. Distinguished ladies and gentlemen, the African Union remains committed to the ideals that were promulgated by the heads of state as they formed the Africa Center for Disease Control, and have charged the Africa Center for Disease Control to work closely with World Health Organization and individual public health institutes to ensure that we bring to a halt COVID-19 outbreak. I'd like to now go into today's debrief. Members of the press, countrymen and women, in the last 24 hours, Zambia has recorded 3 new cases of COVID-19. The first case involves a 58-year-old man who is a contact to a confirmed case that traveled to one of the COVID high-risk jurisdictions. And the second is his 13-year-old daughter. The third case involves a 41-year-old female who is a primary contact to the patient that died at the University Teaching Hospital and was followed up as part of the people that came into contact with him in the last 14 days. All the new cases have now been put in isolation at the Levi Mwanawasa Medical University Teaching Hospital, and this brings therefore the total number of cases that we have in Zambia to 43. Furthermore, we have discharged 2 cases, and therefore under our care we still remain with 11 patients, 2 on the Copperbelt and 2 on the Copperbelt and 11 in Lusaka. Countrymen and women, as I speak about the first 2 patients, I'd just like to make a very strong appeal to all citizens. Those that are breaching quarantine rules, those that are abrogating provisions of the Public Health Act, those that are defying directives that were given in the presidential address, that they will not be at liberty to do so and put the rest of the public at risk. It is important to note that as you defy rules of quarantine, as you hide, as you abrogate the provisions set out in the Public Health Act, and as you defy the guidance that was eloquently given by His Excellency President Edgar Chagwa to the nation, you are putting your family and the rest of Zambians at risk. We have noted with concern that there are individuals that have been defying quarantine rules, and there are some individuals who've been hiding from the surveillance teams.